The Oregon Health Authority soon could be cracking down on a local hospital that it says could be breaking state rules as soon as tomorrow.
It all centers on the Legacy Health's Mount Hood Birthing Center. Let's get out to Fox 12's Kendra Kent, who is live to explain why the hospital is in hot water tonight. Kendra.
Yeah, that's right, Pete. Now, people might remember that it was back in January that Legacy Health made the announcement that they would be closing the birthing center. But now the Oregon Health Authority says that hospitals in the state cannot close their maternity wards without permission from OHA. Now, this latest controversy really just adds to the frustration from community members, healthcare workers, even lawmakers who say that this birthing center needs to stay open.
We were under the clock the day that we delivered her.
2 years ago, COVID protocols forced Desiree Howard to give birth to her preemie daughter at Legacy Emmanuel, despite planning to welcome her here at the Mount Hood Birthing Center in Gresham, the closest hospital from her rural Clackamas County home.
45 minutes on a good day. That's without snow, ice, traffic, everything in between.
For the rhododendron mom, access to health care is a tough part of rural living. But now it's getting harder.
It's just scary. It's really a scary time.
Howard told Fox 12 she hopes to soon give her toddler a younger sibling. In January, she heard Legacy Health's announcement that the Mount Hood Birthing Center would be shut down and patients would be routed to the Randall Children's Hospital in Portland to deliver there instead. Howard says she works all the way up on Mount Hood and has a history of complicated pregnancies and health problems.
I clocked it from my job recently, and it was almost 2 hours to get there. And that was on a good day with minimal snow and minimal ice.
Howard is just one frustrated voice of many calling on the hospital to change its course and keep the birthing center open, joined by healthcare workers and lawmakers alike. And in the latest twist, the Oregon Health Authority is now involved, saying the hospital doesn't have the right to close its maternity ward without state permission. According to OHA, Oregon hospitals must apply for and receive a special waiver to forego birthing services. Thursday, OHA officials reiterated that no such waiver has been approved for Legacy. Earlier this month, the health authority sent this letter to Legacy leadership, warning them that shutting down the birthing center without a waiver could result in repercussions, as severe as losing its hospital license. In the meantime, Legacy Health says it doesn't have the staff to safely operate the birthing center, meaning as of Friday, it will be closed, while everything else remains in limbo. And Howard left hoping it will soon reopen.
I know that Mount Hood Legacy can find a way to keep this birth center open because this was never intended to be a money-making business. It's healthcare, it's safety, it's the well-being of the people that live in these communities.
Now, Legacy Health did apply for that waiver earlier this week. The Oregon Health Authority replied saying that they needed more details and information. So again, at this time, that waiver has not been approved. OHA says there is no timeline for when it could be approved. Meanwhile, the Oregon Nurses Association will be holding a vigil and rally in protest to the closure here. That's tomorrow night. And just in case you were wondering, Legacy says that on average, about 2 to 3 babies are born here each day. Reporting live in Gresham, Kendra Kent, Fox 12 Oregon.